So when you're thinking about the social and community value of what you do, then some of these figures, and these economic figures do matter to policymakers. It's not just good enough having something that is altruistic, something that is morally right, to convince hard-nosed policymakers and press civil servants with competing priorities and policies. It's very important to make an economic case. And one of the inspirational things that you're already doing is let nature feed your senses. A fantastic project that organizes visits to farms for people to have an experience, not just to see how farms work, but to engage socially with others and to get that sense of purpose and meaning and engagement back in their lives. And the evaluation, the impact, the figures have gone up to over 13,000 people who had the opportunity to visit farms on these particular projects. And the outcomes are astonishing. And the good thing about what you're doing is you're not just saying you're going to do something, you're actually doing something and you're evaluating it. And you're not just evaluating it in terms of the impact of what it has on those who visit and the farms that take place. It's the impact on their lives and on the lives of the wider community. So that's really quite fundamental. And I really want to give you a very, very affectionate hug, pat on the back, whatever it is you like in the farming world. You have to engage in social return on investment. This is a new phrase. I don't want you to be worried about it. It's called SROI, and it sounds like something that might be done to you in a scanning department of your local hospital. But it's not. It's very important that we measure things not just by their economic impact, but by their social impact. And it's quite a tricky area of emerging science, but I do want you to be thinking about the economic impact of the work you do and in being a producer of good health and well-being, but the social impact is just as good. Funding, it's complex. To get funding to do some of this work, you will have to apply for project funding. Some of you may even be accessing personalized budgets. Anybody here accessing personalized budgets for the work that you do with local communities? Fantastic. Personalized budgets are budgets given to those who have a social and health need, and instead of giving that to a large provider, they give it to the individual or their family, and they purchase the things they need. And guess what it is they purchase more of? It's less outpatient healthcare and more social engagement. So there is money in this. And there is money that produces better outcomes and benefits for people who have control. So think about psychology, think about control, money in your pocket to buy the services that you need. And there are other complex areas of funding, whether it's local government or clinical commissioning groups. They need to know that you are part of the landscape that they can engage with and purchase services from. But we need to see what the incentives are like within your industry and the disincentives. And it has to capture more than the willing, otherwise it's only ever going to be preaching to the converted. We would like to work with you to look at the impact assessment. I can't just go back to the office and say, met a wonderful group of people, they're doing some amazing things, and they're having a fantastic impact, because they'll say, show me the evidence. And I like the work that you're doing to try and give some answers to those questions. There are green prescriptions, whereby you go to your GP, and your GP, instead of reaching for the prescription pad to write out an antidepressant or an SSRI, will say, look, have you thought about one of the engaging visits or one of the engaging programs that's available in one of our local farms? A fantastic use of public resources, because that may do more to connect that person back to the life they want to live than sitting at home waiting for the antidepressants to kick in. And the partnerships that you can form and the research that you can do will be the gold dust that you need to take what you're doing to the next stage. And lastly, it's not all about sorting illness. It's all about producing wellness. And you understand the means of production. So I want you to be in the mean of production of wellness, which moves away from an obsession with individuals' health. Stop smoking, stop drinking, take physical activity, to a sense of cooperative co-production on wellness, where we are all engaged in that together.